since Social Security Administration's August announcement that our center is one of 2 recipients of a cooperative agreement to participate in the agency's new Disability Research Consortium for the next 5 years. So the other center is located at the National Bureau of Economic Research, led by Jeff Liebman from Harvard's Kennedy School. So my colleagues and I are really delighted to have received this award. Since our inception in 2007, we have been committed to developing the evidence base that's needed to support significant responsible improvements in the nation's disability policies. The DRC award recognizes that commitment, as well as Mathematica's really high quality and extensive disability policy research capabilities. The award also reflects our ability to conduct policy research on issues that cut across multiple agencies and levels of government, as will be illustrated by the research presented by a couple of our speakers today. I'm also pleased to say that our center's DRC team is joined by disability policy researchers at the University of Illinois Chicago and the University of Massachusetts Medical School and the Virginia Commonwealth University. We've collaborated with people at these schools for a number of years in various ways, and their capabilities strengthen our team's capabilities in critical areas. There's some additional information about the DRC in your packets, and more will be forthcoming on our website as we work with SSA and NBER to get the DRC up and running. So more in the future. I think a great thing about it is it's going to help us do a lot more research and also do more policy forums in the future. On to today's panelists. Today we will be presenting some new findings on the employment of people with disabilities and services intended to help them work. I'm sure most of you are aware that the economic fortunes of people with disabilities are very low, and they've been declining relative to those of other populations for several decades now. Among adults age 18 to 64, for instance, only a third of people with disabilities are employed, compared with about 73% for their counterparts without disabilities. So our panelists all have significant expertise on the employment of people with disabilities and the disability support system. The first is Gina Livermore, a senior researcher at Mathematica and my collaborator for longer than I'm sure she would like to remember. We'll describe the impact of the Great Recession on employment and labor force participation of people with disabilities relative to their peers without disabilities. Next, Todd Honeycutt, a researcher from Mathematica's Princeton office, will present findings from new research on the impact of vocational waiting times at vocational rehabilitation service agencies on SSDI beneficiaries and their employment outcomes. And finally, Frank Martin, who's a researcher here in the DC office, will provide new statistics on the extent to which VR agencies, vocational rehabilitation agencies, serve clients who are en route to becoming SSDI beneficiaries. They're not already on the rolls when they start at VR. We are also honored to have Jack Smulligan to offer his insights and perspective on disability employment policy and the relevance of the results that are presented by my colleagues. Those who are here can see that Jack is not actually here yet, but he's en route. He's promised to make it. He's going to be late. He was detained because of a meeting concerning a briefing of the White House. So he is a branch chief for the income maintenance branch of the Office of Management and Budget, and he has an instrumental role in reviewing programs within the Social Security Administration and also low-income assistance programs in HHS, USDA, and the Treasury Department. From January of 2012 until last month, he was on sabbatical as a guest scholar at the Brookings Institution, as well as a research fellow at the Harvard Kennedy School. And he and Jeff Liebman have written what I think is ultimately going to be a very influential paper on the structural problems with disability policy and on how we can develop the evidence base to support significant policy reforms. So hopefully he'll make it as planned and have some interesting, I'm sure if he does, he'll have interesting things to say. The work that's going to be highlighted in today's presentations was funded by federal agencies through grants or cooperative agreements with 3 universities. Mathematica is a sub-grantee under each of these. The funders include the National Institute on Disability and Rehabilitation Research. The funding came via the Rehabilitation Research and Training Center on Employment, Policy, and Measurement, which is at the University of New Hampshire. Another project was funded by the Rehabilitation Services Administration through a cooperative agreement to the Institute for Community Inclusion at the University of Massachusetts in Boston. And then the final one, the funding is from the Social Security Administration through a grant to the University of Michigan's Retirement Research Center. So we're very grateful for the funding from all three agencies. And by the way, the Social Security Administration also provided funding for today's forum. We are grateful for their support. Of course, the contents of the presentations do not necessarily represent the policies of NIDR, RSA, SSA, or any other federal agency. Let's see. At the conclusion of the presentations and comments by Jack Smulligan, we will entertain questions from both the in-house audience and the webinar audience. For those of you who are on the web, we welcome you can submit your questions at any time. I think you've already been instructed on how you can do that. We'd like you to identify who you are and your affiliation, and we ask that you limit your comments to one question only, and that applies to people in the room as well. To help ensure the highest possible sound quality for all of the webinar participants, we do ask that those of you who are in the room will silence your electronic devices and otherwise stay silent during the presentations and during the Q&A as much as you can. Finally, for those here, in your packets on the chairs, you'll find materials from today's event, and you'll also find a comment card. We'd really be happy to have your comments about today's presentation, but also ideas that you might have about policy forums that we could conduct in the future. So now I'm pleased to turn the podium over to my colleague, Gina Livermore.
All right. Today I'm going to speak about employment and economic well-being of people with disabilities before and after the Great Recession. And my co-author in this work is Todd Honeycutt. And the purpose of this study was pretty simple and straightforward. We just wanted to look at the employment outcomes and a few indicators of economic well-being for working-age people with disabilities from 2006 to 2010 and compare them to their non-disabled counterparts. And we focus on working-age individuals, age 18 to 64. And this period that we look at spans one calendar year before to one calendar year after the recession that occurred from December 2007 to June 2009. And we want to assess how people with disabilities fared during this period relative to their non-disabled counterparts. And this is of interest because there's been a lot of recent focus on the employment of people with disabilities. There's lots of new programs and policies out there that are designed to promote their employment and reduce their long-term dependence on Social Security disability programs. And there have been a lot of concerns about a longer-term downward trend in the employment of people with disabilities and the rapid growth in the disability programs. So how people with disabilities fared during this period has implications for future growth in the programs. And this recession was very significant relative to other ones we've experienced, both in terms of the magnitude, but what's been a little bit unique about it is even though we saw slightly higher unemployment rates in the 80s, this one has persisted much longer than any others that we've had in this century probably. Most under other recessions, unemployment has tend to go back to levels, within about 18 months. We're now 3.5 years out, and unemployment is still higher than it was during the pre-recession period. So it's been a very significant recession with likely important implications for people with and without disabilities. So the data we use for this come from two different surveys, or the data I'm going to present here anyway. The current population survey, CPS, is March annual social and economic supplement for the years 2006 through 2011, and we're able to look at people with and without disabilities in that survey. And I also show a few statistics from the 2006 and 2010 National Beneficiary Survey, which is a survey of the employment efforts of just Social Security disability beneficiaries, those between the ages of 18 and 64 on SSI or SSDI. In the CPS, we use a disability measure that's defined as someone responding that they're limited in the amount of kind of work that they can do because of a physical or mental condition, or they indicated that they received income from one of several disability programs during the year the prior year, and those programs include the Social Security disability programs, private disability insurance, or veterans disability benefits. So then we just look at some selected employment and economic outcomes for both surveys. So this first slide is based on the CPS and shows the 5 years that we looked at, and it's the distribution of people with disabilities on the left and people without disabilities on the right, working age individuals, and just what their status is at the point in time. So each bar represents everyone, and the black bar represents the share that are employed, the red bar, the share that are looking for work, and the gray bar, the shares that aren't in the labor force. They're not looking for work or they're not working. So, you know, just a couple things real quick that strike you from looking at this, and it's not new because of the recession, is people with disabilities are far less likely to be in the labor force compared to those without disabilities. It's almost reverse. As many employed people without disabilities there are people with disabilities not in the labor force in the high 70%. The other kind of striking thing about this is the red area and how it increased over time. That's unemployment or people looking for work, and it's much more marked among people without disabilities than you see among people with disabilities, although it grew for both groups. So here's some maybe more familiar statistics than looking at the distribution of the population. Labor force participation, that's people either employed or looking for work. Over this period, 2006 to 2010, both declined very little, if at all, which might be a little surprising because, or at least one expectation might be people with disabilities might withdraw from the labor force after discouraged unemployment attempts and seek Social Security benefits instead, but we don't really see that real strongly in this short period. The unemployment rate, which is the people looking for work over as a share of everyone in the labor force, so it's slightly different than the number I showed before, but this is the official number that you see quoted, grew for both groups, but relatively larger increase for people without disabilities. So people with disabilities generally have higher unemployment anyway. They went from 13% to 18%, whereas for people without disabilities it rose from 4.5% to 10%. And then another figure that's often looked at, especially with respect to people with disabilities, is the annual employment rate. And that's, did they work at all during the year? Did they even have any kind of job at all for any period of time? And for both groups, it fell by about 4 percentage points, which is a little more for people with disabilities in a relative sense. But people with disabilities went from 29% to 25%, and people without disabilities about 84 to 80%. But one thing you have to keep in mind when you look at the numbers for people with disabilities is their annual employment rates have been falling for the past 25 years. So that 4-point decline I showed on the previous slide for the period just after this, 2006 to 2010, is not out of whack with what's been going on since the mid-1990s. They've been falling about 4 points every 5 years since the mid-90s. And the bottom line shows people with disabilities in 1980, 47.1% annual employment rates. In 2005, they're down to 30%. Whereas the top line for people without disabilities, the red one, it's stayed fairly constant over time. So another thing we looked at were what were the characteristics of the jobs of people who actually had jobs during this period, and did they change from 2006 to 2010? And the bottom line here is they changed much more dramatically for people with disabilities. For both groups, you saw declines in full-time employment and in the sales, blue-collar, the goods-producing sectors. But the declines were much larger for people with disabilities than those without disabilities. So looking at income and poverty, annual income in 2010 dollars is shown here. Both showed about a 7% decline in income. so they showed equal declines, but it wasn't significant for people with disabilities. And poverty rate went up for both groups by about 3 percentage points, but relatively, in percentage terms, it was much more dramatic for people without disabilities. And you can just see the relative, people with disabilities, you know, always had, even before the recession, much lower incomes and considerably higher poverty rates. So looking at Social Security disability beneficiaries, SSI and DI folks from these two surveys, their employment rates are about a third what other people's in the CPS with disabilities rates were during this period, and they fell. But poverty did not change for these individuals. So in summary, from 2006 to 2010, the changes experienced by people with disabilities were similar to or even less dramatic than those experienced by their counterparts without disabilities. Employment for both groups declined markedly, but for people with disabilities, it may not entirely have been due to the recession, as there's been this longer-term decline due to a variety of other factors. For both groups, income fell similarly, but poverty increased by less for people with disabilities. And the changes in distribution of jobs was much greater for people with disabilities, and in particular declines in full-time employment, goods-producing, blue-collar, and sales jobs. And a lot of these jobs are associated with lower levels of education or lower skills, and other work that we've done in this paper and in other studies shown that the recession did hit people with lower skills and lower levels of education disproportionately, and if more people with disabilities are in those groups, they were likely to be hit harder by that. So one other observation is that the recessionary effects on people with disabilities get somewhat muted when you look at the population as a whole, the way that I've presented it here, and it's because, you know, earnings is what gets affected when you're unemployed, and they have substantially lower labor force participation in employment, and so the recessionary effects on earnings is less significant for them. When you only have 28% of the people in the labor force are working instead of 78%, the impacts are going to be a lot less. So that's why we see more dramatic changes for people without disabilities than those with disabilities. You also see lower declines in income and poverty, partly maybe due to because their reliance on public programs, and that buffered the effects of the recession because they don't rely on earnings as much. The recovery from the recession, as I said before, has been really slow, and it's still too early to see what the long-term impacts are going to be on employment and participation in the disability programs. We did observe a really large increase in the applications to SSDI. In 2009, it went up by like 16% compared to 3 to 5% increases the years preceding that. And it's likely that that this bulk of people going through are going to stay on the rolls and increase the already strained trust funds and fiscal issues of those programs in the future. And that the long-term program growth that we've been seeing due to other factors is likely to be exacerbated by this recession, and it probably will feel the effects going forward. But at this point, it's a little too early to see it out. Right? So on that happy note, I'll hand it over to Todd.
Hi, everybody. I'm Todd Honeycutt, staff medic. I'm going to be presenting on waiting times for vocational rehabilitation services and how that influences employment outcomes. This is work I've done with my colleague, Dave Stapleton. So to provide some background to this issue, vocational rehabilitation agencies represent the largest employment-related federal expenditure for people with disabilities. It has an annual budget of almost $4 billion, 21% of which comes from the states. So it's a joint program between federal and state governments. And it provides services to anyone who has an impairment that interferes with work, who can benefit from vocational rehabilitation services, and who requires those services to achieve a specific employment outcome. So VR agencies often have long waiting lists for services because of resource limitations. They don't have sufficient funding for services. They don't have sufficient staff. So in those situations, they enter into what is called an order of selection. Order of selection means that the agency is only going to serve those individuals who are most in need, who have the most significant disabilities. We present numbers here on the number of agencies who were in order of selection status in 2005 and in 2010. And in both, almost half of agencies were in order of selection status. Most had either no waiting list for services or a very small portion of their applicants in a given year on a wait list. You had 6 agencies in 2005 who had almost or between 10 and 49% of their applicants in that year on a wait list. And you had 6 agencies with half or more of their applicants on a wait list. In 2010, it's a little bit different situation. You see fewer agencies who have a low proportion of their applicants on a wait list, and slightly more in that 10 to 49% range. So when a waiting list is in effect, an order of selection is in effect, the agency must serve those with the most significant disabilities first. Likely, those individuals on Social Security disability insurance and supplemental security income would likely be considered as most disabled. There's no regulation that says that they have to be. But these are individuals who clearly have an impairment with their ability to work, and so you think that they would be in that most significant group. But even if they're classified as most significantly disabled, the wait may still be long for these beneficiaries in some states in some years. So we ask the question, are long waits detrimental to employment outcomes? Our initial focus and the focus of this talk here is on SSDI-only beneficiaries, those individuals who receive SSDI but not SSI benefits. And that's an aspect of this demonstration project that we're working on. The idea of this project is to identify agency-level factors that those things that are under a VR agency's control that they can manipulate to help improve the outcomes for this population, SSDI-only folks. So we're asking whether we should test whether the acceleration of service delivery could improve outcomes, whether we should test that in this demonstration project. But a future focus for this framework for what we're presenting today could be applied to other VR applicants, SSI beneficiaries, and people who don't have benefits when they apply and what their outcomes are. So the data that we use for the analysis are RSA 911 data. Those are administrative records, closure records for VR agencies. We look at the years 2005 to 2009. And from those 4 years, we pull out data for an applicant cohort, those individuals who applied in 2005. And so we're able to look at their outcomes over a long period of time. We match these data to SSA's ticket research file, and this enables us to do 2 things, which are important. One, we can identify those individuals who are receiving SSDI-only benefits at the time that they apply, which is something you can't do with 100% accuracy with just the RSA 911 data. We're also able to look at long-term outcomes. With the RSA 911 data, you can get outcomes in terms of what happens to them as part of the VR agency experience. But with the SSA data, you can look at outcomes for everybody, no matter when they exited out of services. And you can look at it for a longer period of time. And here we're looking at these outcomes for up to 4 years after they first apply. We have several exclusions for the data. And our final sample size is 36,187 VR applicants who were SSDI-only beneficiaries in 2005. And what we wanted to understand was this idea of wait time and how waiting for services influences these outcomes. And so what we did was we created an aggregate measure of a usual wait time. We looked at it by state, agency, and by month of application. So we looked at everybody who applied in a given month in a given agency. And then we looked at the time between application, the date of application, and the date that they received an individualized plan of employment, so an IPE. So we looked at that. We calculated that in terms of months. For those, but one problem with that kind of measure is that a lot of people don't make it to that IPE stage. They're not found eligible. They exit out of services before then. But we wanted to account for the fact that a large group, we want to account for the fact that people may exit out of services because there's a long waiting list. And so for this aggregate measure that we're using, the usual wait time, we assigned a value of 99 or 99 months for those who didn't get to that IPE stage. And then we took the 33rd percentile of the distribution within a state and a month to kind of get this usual wait time measure. So when we say that the usual wait time in a given agency in a given month is 2 months, what we're saying is really 33% or a third of the applicants to that agency for that month made it to the IPE stage within 2 months. And in this slide, we're showing the distribution of usual wait time for our sample. And you can see that for most applicants, they applied in state and month combinations in which the usual wait time was between 1 and 4, 1 and 5 months. But you also see this long tail, and that's showing that, or suggesting that for a lot of folks, there was a fairly long wait period before getting services, or before that group got services. Now, from the SSA data, we use 5 measures. We look at trial work, any evidence of a trial work period. Trial work period is a work incentive from SSA that encourages individuals who have SSD-only benefits to work and still retain their benefits for a period, 9 months, within a 60-month period. We look at whether these individuals started a trial work period or completed a trial work period after application, after their VR application. We look at the number of months of earnings that were at the SGA level or above. SGA is substantial gainful activity level. Again, it's a certain threshold that SSA uses. In 2005, that level was $830 a month. We also look at the suspension or termination of benefits, of SSDI benefits due to work, whether there was any suspension or termination of benefits during our period of observation, or and also the number of months in that status, in that non-pay status. And we measured this at 4 time periods, at 12 months after application, 24 months, 36, and 48 months. Here's the descriptive table on these outcome characters or outcome measures, and I'll focus on this last column over here on the right, the 48 months. So within 48 months of this cohort applying for benefits, 19.7% had started a trial work period. 15.8% had completed a trial work period during this time frame. They had, on average, 2.76 months of earnings at the SGA level or above, as recorded in the SSA administrative data. 9.3% had at least 1 month of their benefits being suspended or terminated due to work, and for the sample, they averaged 1.3 months off the rolls. Here's a nice plot, and it shows very clearly that there's this negative relationship between this usual wait time that we've calculated and one of our outcomes. Our outcome here is the number of months with earnings at the SGA level or above, and you see that with an increase in the usual wait time, the number of months decreases, and that's quite a clear relationship. That was easy to explain to my 9-year-old son last night as I was practicing this with him. He's learning about graphs and how to plot things, so I was trying to tie what I do in with what he's doing at school. So what we wanted to do, that's just a descriptive kind of analysis. What we wanted to do was wanted to control for individual factors, agency factors, state economic factors, just to see if that relationship still remains. And so we used regression models to do that. And what we found was that, first we did observe a negative relationship between usual wait time and all of our outcomes. At 48 months, we found a significant relationship, significant at the P.05 level, between the trial work period completion and the number of months with SGA earnings and the usual wait time. The relationship was significant at P less than 0.10 for starting a trial work period, and the number of months with suspension or termination of benefits due to work. And though the relationship was negative between any suspension or termination of benefits due to work, it wasn't significant at conventional levels. And when we were presenting this information with our technical advisory panel, one of the comments was, these results are interesting, but could what be, one thing that could be driving your results is the idea that, or are these agencies with very severe wait times. So by including those individuals who applied to agencies that had these long wait times, you're biasing the results. And so what we did was we removed applicants to agencies that had these severe waiting times, or a large proportion of their applicants on a wait list, the 10% or more of applicants in the given year. When we exclude them, we found some interesting things and somewhat surprising. When we did that, the negative relationship that we observed between the usual wait time and our outcomes still existed. The effect of the usual wait time on the outcomes was larger in magnitude than we observed when we looked at everybody together. And it was significant at the P05 level for all of our outcomes at 48 months and for most of the other periods as well. So there's a stronger relationship. And the reason for that is you can see somewhat with this figure. This is the same figure that I presented earlier. Usual wait time is along the x-axis. Along the y-axis is the number of SGA earnings months. And you see that the solid line shows agencies with no or a very low wait list. The dotted line shows the agencies that have a more severe wait list. And what you see very clearly is that even in agencies with a severe wait list, when the usual wait time is fairly quick, 2, 3, 4 months, the outcomes are poorer. So then you see with the agencies with no or small wait lists. So there are some interesting policy implications for state agencies. Assuming a linear relationship between usual wait time and the outcomes, if you were able to reduce the usual wait time to 2 months for an agency, you'd find one thing that could happen is a increase in the number of months in which benefits weren't paid, and the benefits were in a non-pay status of 4.3%, and assuming that an agency could get ticket payments for all those months, that would result in $1.5 million more in payments from SSA to VR agencies. And if that waiting time could be reduced to 0 months, then the savings or the payments generated would be that much more. So there are some important caveats to this analysis. One is that we're looking at a cohort of applicants in 2005, and when we're looking at that 4-year outcome, 4 years is 2009, that's at the bottom of the recession that Gina just presented some statistics on. So employment outcomes may not have been all that great. It also assumes that this measure of usual wait time that we're calculating is not correlated with some important unobserved factors, state policy environment, factors that may impede funding, VR funding, or state agency characteristics that may be stretching out the wait time. And the payments savings that I present are really the maximum possible, and so may be overstated. So to conclude, we find that long wait times for VR services appear to delay employment outcomes for SSDI-only clients, and with financial consequences, not just for the individuals who are applying for services and seeking help, but also for VR agencies and Social Security Administration. A rigorous test of the impacts of expedited services for SSDI-only beneficiaries would be worthwhile, and that's what we're hoping to do with the SGA project as part of the demonstration that will be incorporated into one of the models, this idea of expedited services. And then there's other issues that this study raises, and one is whether service delays for VR applicants who don't receive benefits actually increase the rate of their application to the SSDI program. Thank you, and I'll turn it over to Frank Martin.
Thanks, Todd. So today I'm going to present findings on a study about people with disabilities who apply for vocational rehabilitation services and then subsequently enter or are awarded Social Security disability benefits. And in particular, people who were not receiving SSD at the time of application, but then later on entered SSD. And we think that VR is a very important program to study for this, with regards to this, because VR agencies can potentially help people stay at work or remain at work after the onset of a disability instead of entering Social Security disability programs. So our central question is VR an early intervention? Can it help? But conversely, since this hasn't really been studied, There's another question, does VR accelerate or facilitate SSD entry? Those are important questions. So over the next few minutes, I'm going to just share with you some background about the programs. I'm going to tell you about the data that we use to look at these questions. I'll share with you some findings and talk about the implications. The study, Dave Stapleton is the principal investigator of this project. We've received a lot of help from SSA on this as well. So first, when I say SSD, I'm referring to individuals who receive an award based on their work history, traditionally SSDI. But people can also receive an award based on the award of a parent or of a deceased spouse. So we collectively are describing this group as Social Security Disability Beneficiaries, or SSD. All of these groups could potentially benefit from VR services. SSD is also, it's an essential lifeline for millions of Americans. I think about my own family, and I'm not quite sure how, we would be able to manage without SSD and Medicare that comes along with it for some of our family's needs. So it's a very important program, but there are a lot of policy concerns about it. The number of people entering SSD are increasing. It's very large, and it increases every year. The costs are quite high. Over 9.4 million people receive SSD, 8.2 million of which are on SSDI alone. And according to the SSA's actuaries, by 2016, the trust fund will be exhausted. So strategies, ideas need to be thought of. And we think VR, again, is one potential point of early intervention. As Todd mentioned, it's another very large program for people with disabilities. They can offer education, training, job placement services. But to this point, it's not quite clear if consumers who apply for VR are using it in order to delay SSD entry. And those are essentially our questions. At a very exploratory stage, how many people who apply for VR who are not on SSD actually enter SSD? And what are their demographic characteristics? If we want to develop and think of interventions that will help, we need to know more about the population. And what type of variation is there in SSD entry across states? Each state runs its own VR agency. So we think that those are important questions to explore. Now, the data for this study comes from RSA. The RSA 911 includes records on every VR client. We also use data from SSA on disability programs. When you match those together, you can learn about SSD status at time of application, 12 months, 24 months, and so forth. We are also very interested in the disability insured status before applicants apply for VR. Disability insured status basically means eligibility for SSDI. We create one-year cohorts of first-time applicants from 1998 to 2005. By first time, I mean, in VR, people can apply multiple times. You could be closed for services. We're interested in the initial first-time experience of people with disabilities as they enter VR. I've also shared with you some descriptive statistics specifically for the fiscal year 2002 cohort. So let's look at some numbers. First off, this chart shows the number of number of consumers awarded SSD at the time, at or before the time of application, at the time of closure, and then 60 months after time of application. The first bar on the left, the blue bar, indicates at time of application. What's really important to notice here is that the number of people who enter SSD after application jumps tremendously. In 2003 alone, over 50,000 new people entered SSD after time of application. Also, each year, the number of people entering SSD increases each year. In this chart, we're looking at SSD entry by applicants at 12-month intervals. So if we looked at just the 1999 trend line, for example, at the time of application, which is indicated here by 0 months, there were 2.8% of VR applicants had received or were awarded SSD at the time of application. That number increases dramatically over 36 months, and by 60 months or 5 years out, it's 14.5%. The next few slides that I'm going to share with you are specific to 2002. The first is the percentage of applicants who were awarded SSD by age group. People in the 50 to 59-year-old age group were most likely to have been awarded SSD at each time point, at time of application, at time of close, and at 60 months. What's quite interesting about this graphic as well is that the 50 to 59-year-old age group actually represents a relatively small percentage of the VR population overall, only 12%. In terms of education, VR records highest level of educational attainment at time of application. We looked at those data and found that, in general, the higher the level of education at time of application, the more likely a person had been awarded SSD. For example, in this slide, people who had a high school diploma, or high school graduate, or GED, 5.8% were awarded SSD by time of application. If you look at people with a bachelor's degree, 9.8% had received a bachelor's degree. The gap is persistent at 60 months as well, though much higher. SSI is a different program. It's based on low income and low resources. But for people who apply for VR who are on SSI, many of them have already entered SSD by the time of application, 28.3%, and that number jumps dramatically at time of close, nearly 50%. By 60 months after time of application, the vast majority have received or awarded SSD. This graph, which should be a lot prettier in your handout than on the screen, shows the states that run VR agencies and the percentage that have been awarded SSD. It's ordered in magnitude by the 60th month. What you can see on the left-hand side, some of the states with higher percentages include Massachusetts and New Hampshire. Some with the lower rates include Utah, South Carolina. Some of the higher states are twice the percentage of SSD entry than some of the lower ones. Okay, so I'm running short of time, so I'm going to skip this slide up. Basically, I just want to summarize some of the data for you, and I think we can talk more about it during the discussion. I would like to spend more time on trying to explain some of the reasons why we think VR might facilitate SSD entry. In some ways, VR can actually help delay VR entry, and we think it can help delay entry for people who are capable of earning SGA, for people who are relatively motivated, and for people who move quickly through the VR system. But in many ways, VR actually can help facilitate SSD entry. They could do so because there's an incentive for VR agencies to help people who are on SSD as opposed to not SSD. VR agencies get reimbursed by SSA when they help a person on SSD attain SGA. So for a person who is not on SSD at time of application, VR agencies can help people become DI insured, which can then subsequently lead to SSD. Another potential incentive is Medicare. After 24 months of SSD, after an SSD award, individuals are eligible for Medicare. And so that's an incentive for the states to shift some of the expenses and costs that they pay to the federal government. Now, we don't have any evidence to suggest or indicate that VR agencies are intentionally promoting SSD for clients, but I do wonder if a different VR reimbursement strategy would affect SSD entry. My final point here that I'd like to make is just to try and put some of these numbers in perspective, and this is a point that Dave Stapleton made. In 2003, over 50,000 people entered SSD after VR application, but that number is really modest in relationship to the total number of people who entered SSD. But there's still an important point here in terms of VR's potential for early intervention, because if VR agencies could, and I'll just stick with delay SSD entry for 10,000 people over a period of 10 years, the potential cost savings is on the order of $1.7 billion in terms of SSD and Medicare. So I'm going to stop there there are a lot of, I think, very important issues to further explore with these data to try and come up with strategies and solutions that will help improve the SSD system for people in the future. Thank you.
Okay, well, I'm pleased to say that Jack Smallothigan did show up, not in time to hear the disparaging things I said about him, but he's here for his comments. And I want to remind the web audience, please start submitting your questions now so that we can be ready to go with them as soon as Jack is finished. Thank you. There we go.
Thank you, and I'm kind of grateful for Gina to give me an advance preview of her materials because I knew I was going to have to be a little bit late for this. And I should just say by way of caveat that this is, while I'm right now back at Office Management and Budget, I'm really speaking from my time on sabbatical as a guest scholar at the Brookings Institution, is looking at the Social Security Disability Program. So I am not speaking for OMB in this capacity. Yes? Oh, is that better? Okay. All right. Thanks. Okay. Good. So let me start with Gina's presentation because she really provides some very timely analysis, and she does sort of show really a distressing employment trend and one that sort of compounds a longer-standing trend of declining employment prospects for people with disabilities that is very troubling and predates the Great Recession. And she did note that there is some clear evidence that the safety net protections are making a difference, that the income decline is actually less than what you might expect from looking at the employment declines, and so there is clearly some safety net protections being provided by the Social Security disability programs, and yet these trends, particularly the cyclical trends during periods of high unemployment, are a serious cause for concern, because we know from past research that with recessions, participation increases in disability programs, and that once people enter the programs, they often are very unlikely to leave. And we find that other developed countries really have a similar phenomenon, that it's difficult to exit the program once you've entered. And so what does that suggest for policy? I mean, it's very difficult for the government to influence the kind of macroeconomic conditions, but can we influence the kind of micro economic variables that affect a particular individual with disabilities? And so we know from other contexts that the earned income tax credit helped low-income mothers with children substantially increase their participation in the workforce. And so could we provide something similar? Could we provide like a disabled worker tax credit to be able to buffer the effects of the economy for people with disabilities and help them retain a foothold in the labor market and off of the long-term disability programs? And so I think it definitely raises questions for further study. And that is actually what makes the next presentation that Todd provides very useful, because what is kind of VR's best role in this context for keeping people in employment? And the use of kind of wait time data, I think, provides really a creative opportunity, and it sort of joins kind of a growing body of research that tries to use variation in administrative data to provide important information, and really at low cost compared to doing like a randomized control trial. And so I think it really provides kind of very useful kind of and very suggestive information. But I think, as Todd notes, there's just invariably caveats that you cannot really cannot rule out that there's some unobserved factors that might be explaining the relationships that his presentation showed. And so I think it definitely does argue that sort of the next step is to perform some randomized experiments to understand if you really substantially change wait times, would that materially affect the entrance onto the disability programs. And the reality that we do have substantial wait times obviously creates an ability to have a control group to see what some experiments would demonstrate. And I think as Todd kind of raised at the end of his presentation, I think it also raises the question of how do we prioritize VR services overall? because sort of by definition, prioritizing people with participating in SSDI and SSI is very important, but sort of by definition, you've built in a wait time because we all know how long it takes to be able to get on those programs in the first place. And so what are we doing for someone with a very equivalent set of impairments who might not yet have applied for the programs and yet might need help? And are we building in, sort of hardwiring in a system in VR that sort of assumes a wait time to first get on SSI or SSDI before you get services and sort of by design essentially reducing your prospects. And so it does raise some kind of fundamental questions about VR's order of selection rules and whether we want to test some interventions that try to reach people as early as possible and before they're on the DI or SSI programs. And that is where the next presentation really just kind of flows from what Todd presented, because Frank really provides some useful descriptive information on the relationships between applying for VR and then later getting on to DI, and he clearly shows substantial rates of DI awards after application for VR services. But obviously, what that descriptive information can't tell us is what might have happened absent the existence of the VR services in the first place. And so I think it does go back to the earlier point that we need to look at, can we do some rigorous evaluations to really understand the difference the VR system is making in keeping people in the workforce and off of the long-term disability benefit programs. And I think without that data, and without some of the really rigorous evaluations, there's just really some fundamental things that we can't know from a policy perspective in terms of the kind of funding that Congress should provide in the future in this area. But thank you very much for inviting me, and certainly enjoyed the presentations.
Thank you, Jack. We were very glad to see you. So, right. Questions and answers. Should we start with one in the room? Yes. And please say your name and affiliation.
Hi, I'm Dr. Caroline Poplin. I'm a general internist, and I work part-time at Social Security in Baltimore from 2008 to 2010, reviewing disability applications. And what I saw, and of course that was not a random sample at all, it was whatever got sent to us. And no mental problems were dealt with somewhere else, and children's problems somewhere else. What I saw were not people leaving the workforce because of disability. They were people who had lost their jobs, who had a disability, and they had been out of the workforce a couple of years, living in trailers, homeless shelters, moving in with friends, and then they finally applied for disability. And they weren't disabled, but on the other hand, they had more than minimal impairment, so that put them into the middle group where my understanding is you look at age and training and look to see whether the person can be retrained or is there something they can do. The problem wasn't so much that they needed training or rehabilitation. The problem was there were no jobs. And what they said at Social Security was, we're not a jobs agency. We award disability. And if we say they're qualified for a job, if there's no job, that's not our problem. And I don't know what percentage of the disabled population that is, but these were people who were working, who lost their jobs, who also had a disability. And finally, the disability became like a tax loss. It was a way to be supported, and it was completely legal. And I think it should be. But if you have the rehabilitation, but there's no job at the end of it, it seems to me that's a problem.
So I'm not really sure what your question was. It was a very interesting observation, and from your perspective...
The vocational rehabilitation come along with the job. I mean, when they do the VR, if there's no job at the end of it, then you're going to get someone, who's on disability.
Sure. Yeah. Does anybody want to respond to that? I mean, it's probably beyond your skill level, right? But it's still a very interesting observation. Maybe you can comment on it.
Yeah, it would sort of reinforce how much we don't know. I mean, and I think one of the important questions is, do people need services? Do they need VR? Or do they need more, like, say, a wage supplement? And when we look at, like, welfare policy, I mean, we provided enhanced child care for low-income mothers, and we also provided the earned income tax credit. And I think that different people would say, well, the child care made the difference, and other people would say EITC made the difference. I mean, I think what we need to be able to do is evaluate both. I mean, that it may be that what somebody needs is the wage supplement so they can take a job that perhaps doesn't pay as much as the last one, but, you know, or medical care, yes. And maybe they do need the VR services so they can actually learn a new skill. And I think until we do some more kind of really rigorous work in this area, we won't be able to answer that question, but it's a good one.
Yeah. I think another key is to contact the person before they actually leave their job. Yeah.
All right, I'm going to cut you off because the people on the web can't hear without the mic. So, yeah, we'll bring it back to you in a minute. So, go ahead in the back.
Yeah, Lori Collins from the U.S. Department of Education. I just wanted to make one point that within the legislation for the VR program, VR counters are required to look for comparable benefits. And so I think that's sort of allude to, but it wasn't specifically stated, but they're actually required to look for comparable benefits. So if you have an individual who would benefit from Social Security, they're going to, particularly when it comes to, the medical benefits, they're going to refer that individual to get benefits in most cases, not necessarily looking at it as the long term, but as a short-term proposition while they're in the VR program.
Is that a federal requirement?
Yes.
Interesting. Okay. Could you, Carmen, take it back to the woman who was speaking a minute ago? Give her a chance to follow up, but then I want to move on to others. We got several hands up.
Oh, I'm sorry. I guess my point is that you have a specific model in mind, a person who is working, who becomes disabled. And all the people I saw were people who were disabled and who were working and who lost their jobs. Had nothing to do with their disability. The employer went bankrupt or moved to China or whatever, and they had no jobs. And they wanted to work. It was clear from their applications, and they had tried, and there were no jobs for them. And after a couple of years of living really hand to mouth, they applied for disability, and they had a disability, and they qualified. So all of this discussion of, I wonder how much of your population is people in your model who are working and have a stroke, become disabled, versus the people I saw who were working, became unemployed, tried to get a job, couldn't find a job, and then applied for disability.
Yeah, let me just make one comment, and we'll move on to something else. I think this is a really important point, and there has been a lot of policy discussion lately about how to intervene when people are still with their employer, and I still think that's a very important line of policy discussion, but it doesn't address this group that you've described. So it seems like to address this group, you need a different line of policy interventions and discussions, and it's one that we're very interested in, but I think has not received enough attention. It's coming to the fore because of the current recession. So let me see if we take time out to get one from the audience, from the web audience, if we have. Allison, go ahead when you're ready.
Okay, this question is from Mark Misruck. He says, the National Working Positive Coalition has advocated for early post-diagnosis vocational rehabilitation interventions for people living with HIV/AIDS. Do today's presentations raise concerns that this would increase SSA applications?
I don't want to take that on. It's a good question. You stumped them all, I don't think. I don't think we have an answer. All right, let's take another one in the audience. Those people on the webinar are too difficult.
Hi, Joanne Schneider, George Washington University. This was really nice, guys. As I think the Mathematica folks know, I recently did a report on unemployment in general and then another separate piece of it on disability, which Gina basically said the same thing. But one thing that struck me here is that 50 to 59 age group, Frank? Yeah. And following on this lady's very apt comment, you know, basically what the larger report found is that, you know, older workers were being thrown out of work regardless of education, et cetera, and weren't finding it again. And anybody who employers thought might cost them money, older, disabled, et cetera, aren't finding it again, and they're the longest term unemployed. So given that, you know, I have three quick questions. Jeannie, you focused on the service workers, et cetera. I was finding a lot more, you know, really stuck people that had education, the folks that Frank are talking about, you know, the bachelor's plus. And so I'm wondering if you looked at that population and the unemployment stuff in there. And I'd like to hear more about that 50 to 59 age group in general. The other two quick comments, I noticed the ITC thing. I think it's a nice idea, but I think a lot of people on disability actually already qualify for it. And I keep thinking employer-employer. So I'm wondering what the thinking is on tax credits for employers as opposed to employees more than what's out there now. And then a final quick comment on the VR piece. A lot of folks don't get to their plan until they've had a lot of other stuff going on, so they may have been served. And I'm wondering, you know, how much of that you can get to given the data you've got.
Okay, so I think you've violated our one-question rule. But I will nevertheless let each of the speakers answer one question.
We did not look at subgroups. We looked a little bit by education level, but that was sort of beyond the point of our paper. So we did not go into depth by age groups, older workers. I do know there's some other work out there that has looked at that.
And about the VR plan comment, that's true. I mean, the idea that, you know, the time between, you know, application and this individualized plan for employment, there's a lot that goes into that you may not be able to compress into, you know, 1 month or 2 months. You know, there's an assessment, a vocational assessment, identifying goals, identifying ways to meet those goals. So just, you know, rushing things along may not be the best option, but I think it is worth a test. I mean, you know, waiting 12 months or 20 months, 30 months, you know, is really, I think, quite a long time to do those sort of preliminary planning activity.
50 to 59-year-old age group, it is a group that is commonly going into SSD. I think one of the things that would be interesting to look at is how many people are using SSD as a pre-retirement type of program, because afterwards people transfer into SSA retirement benefits.
Do you want to weigh in, or you don't have to? All right. Let's go on to the next question. Do you have another one from the web audience?
This question is from Michael Dalto, and I believe it's for Todd. Will the SGA project control for the likelihood that VR agencies with long wait times may provide lower quality services than those with shorter wait times? And will you consider whether people may simply be more likely to go to work when they're newly disabled?
I think this person's asking about how we might operationalize this idea of having a short wait time. The idea behind the SGA project is to identify, you know, at least 3 agencies who are willing to make changes in a randomized control study to kind of see what may affect the outcomes. And so for this idea of an expedited connection to services, it's not necessarily looking at agencies that have very long wait times already. It's the idea of saying, okay, for a certain group of people, or applicants, you're going to get them to these service milestones at a fairly quick pace. and then look at the outcomes for those individuals relative to those who get that usual pace. It's not expedited. It's what the agency normally does, and so it's that kind of test that we're looking for. The other question, aspect of the question was whether people are more likely to go to work with who are more recently on the rolls. Is that it?
Yeah, when newly disabled.
The idea is that, for the demonstration project, everybody who applies for services would be, assigned to a specific condition. They'd be a part of the project, and so that factor wouldn't necessarily come into play whether they were newly disabled or had been on the rolls a long time. Evidence does suggest that those who are newly on the rolls tend to go back to work at higher rates than those who've been on a long time, though. So it's something you would want to look at.
Yeah, I could add one thing. I think as far as the results that Todd presented, it's possible that the wait time measure is also kind of a proxy for the quality of services delivered, with people waiting longer, receiving lower quality of services. But I'd also point out that when Todd dropped the people who were being served by agencies that were in order of selection, which is what I think the question referred to, the results actually got stronger. So maybe that's less of an issue than might. But either way, I think it's an interesting result. So. All right, one more in the room here. Yes.
Hi, I'm Jen Rigger with the Office of Employment Support Programs at Social Security. Can I break the rule just to ask one clarifying question before I ask my real question? Todd, your research was for 2005 only, right?
It was looking at 2005, a cohort of 2005 applicants.
Okay.
Used data up through 2009.
Okay, so were you able to discern what kind of movement there was in the caseload/wait list for MSD versus SD during any period, or not really? It was just a snapshot.
I'm sorry, could you repeat that?
Well, I think my question is, what's happening to that caseload over time? Or during the recession, for example, did those people stay in wait list status longer? And since you only looked at 2005, I'm assuming that we don't know that.
No, we actually don't know if an individual is on a wait list or not. And from the RSA 911 data, we can just see when they applied and if they got services.
Okay.
So we don't have that individual level data about the types of services they received or how long.
Okay, thanks. That answers my question. I didn't think the 911 gave you enough to know that, so thanks.
You probably know more about those data than we do, I think. So
I was just
I know your history. Another one from the web, maybe?
This question is from Karen Heath, and I believe it's for Frank. Did you look at whether or not clients who received SSD after enrollment were more or less likely to close successfully? We discovered in a small self-employment project that those who had SSD were less likely to launch their business than those who didn't.
No, we didn't look at types of closure per se. We're primarily interested in the fact that people who are applying for VR are indicating and illustrating an intent to work. And so the question is what happens after application for VR. But it's a very, I think, important data point to consider and look at, as well as people who apply for VR and who are deemed ineligible for services. So all of those individual levels closure statuses that the questioner is asking about were not specific to this study.
I think that it's fair to say that the data that Frank put together and has been really developed over several efforts here at Mathematica offers the opportunity to answer questions like that in ways that hasn't been available before. We, as Jen knows and some others know, the RSA 911 data, they appear when people are when they're their service period ends, closure, what they call closure. So we don't, if we look at the annual data that you get from RSA, you don't get to follow people who all apply at the same time and what happens to them later on. And so because of the way we put the data together from many years of RSA 911 data, that we can do that. And also, in addition, we're able to follow them into the Social Security beneficiary rolls. And so I think there's lots of questions that we'd like to be doing research on, and we just got another one from a member of the web audience. So hopefully other people are thinking along the same lines. All right, another one in the room? Yes.
Thank you. I'm Kathy Ruffin from the Center on Budget and Policy Priorities, and my question is primarily for Gina. I was a little surprised, this appears on page 14 of your presentation, at the levels of income that were depicted for both people with and without disabilities. People with disabilities appear to have an average income of around $50,000, and those without disabilities around $90,000. Those appeared high to me. I wanted to confirm that they were individual and not family incomes. Okay, and they and they are a mean and not a median.
They are the averages, right? The medians are lower.
Yes, good. I think it would be particularly interesting, in addition to divide the statistics for people with disabilities between those who are and who are not receiving cash benefits for disability.
We did look at that. We just didn't show the stats here.
You have a paper coming out about this.
Yeah,
right?
but I don't know. We got a million numbers. I'm not sure which are going to wind up in there, but yeah, and the levels are lower on some of those for the people receiving the benefits.
Good point. Another one from the web, perhaps.
This question is from Anna French. In employment, not all jobs are equal. People with disabilities are often guided to have lowered employment expectations. Do your numbers take into account what kinds of jobs people with disabilities are guided toward? I'm not sure specifically which panelist that's for, maybe in general.
Gina, you actually had a slide, I think, that looked at job characteristics, right?
I'm sorry, I was thinking about the other question.
Oh. One question.
I was still one question behind.
It's very previous.
Can you
question.
repeat it?
It's right behind you on the screen if you want.
Sure. To repeat the question, in employment, not all jobs are equal. People with disabilities are often guided to have lowered employment expectations. Do your numbers take into account what kinds of jobs people with disabilities are guided toward?
Well, we don't know anything about how they're guided. We just present what they had. And by some of these measures, well, I don't know that we had any job quality if you're going to measure. These are very broad occupation categories and industry categories, and it really doesn't say much about the quality of the jobs. We did look at earnings. We don't present that information here. But we don't have a lot of measures of quality in that data set.
But we do know, like, full-time versus part-time, full year versus part year.
Full year, yeah.
And we don't really know, why they were in those jobs.
Yeah, we don't know how they got there. Right. We're just describing where they ended up.
And also, though it's not in the studies we present today, in VR data, there are indicators of the types of jobs that individuals receive at closure. And the majority of the types of jobs are in the service industry, and typically lower in pay income compared to the general labor force. So the question is actually spot on about that.
Another one in the room, maybe? Yes, in the back.
So this question is for Mr. Martin, I guess.
Could you identify yourself?
Yeah, sorry. Tom Hackman with the U.S. Department of Education. So there have been legislative proposals out there recently about VR proposing that transition-age youth with disabilities would get priority for services, kind of a new priority group. help them get a good start in the workforce. But I guess I'm just wondering, you mentioned early intervention of a VR that they could do some sorts of services, and I was just wondering, as far as what you were thinking of early intervention, is there any overlap between what you were talking about and giving priority to transition-age youth with disabilities to get VR services?
I think there's some potential there. I think in terms of services for transition-age youth, there actually have been some efforts to have specialty counselors in VR agencies for transition age. Generally, VR counselors serve the entire population, psychiatric disabilities, physical, et cetera. They don't have a lot of specialty counselors, but in the area of transition, that's an area where some VR agencies are actually working with transition age youth. And there's a lot of good reasons. The service systems from secondary education to post-secondary settings are very different when kids move from high school to college or to VR. One is an entitlement program, the other is eligibility-based. So the need for something like that is, I think, very important. Now, in terms of early intervention, what we're referring to is an intervention that helps delay people entering SSD. Most youth, in general, don't have a work history to make them SSDI eligible. So you might want to consider early intervention in terms of trying to promote work, trying to promote or training. A lot of the youth who are in VR are actually in education-related programs, actually for quite some time. So, I think it's an important area to consider, though it doesn't sort of fit the definition of early intervention that I'm using here.
One thing you should know about, maybe you already do, is the youth transition demonstration that SSA has been working on, and we're doing the evaluation for, and I think we'll be presenting on it later in the year. But it really takes that approach, providing early intervention for youth and young adults with disabilities to get them into the labor force, hopefully so that they can become productive adults and not be so reliant on income support from Social Security. Todd, I wonder, I know you're involved in the YTD evaluation. Are there some VR agencies involved in that in some of the sites?
VR agencies have been involved in helping deliver services. They've been partners.
Yeah, they have. Okay, so there is some VR agency involvement. Another one from the web, maybe.
This one's from Janine Collins. If the need for work/work placement supports before reaching the point of eligibility for SSDI is recognized, why is the structure of ticket to work, an after-the-fact model, not being looked at as a means of financing those supports?
Well, we'll look to our director of our evaluation of ticket to work to answer that one.
I think they answered it themselves. It's an after-the-fact program that can't be used to finance services until somebody is on the rolls, if I'm understanding the question correctly. OMB guy might be able to answer it a little more about why Social Security is only allowed to offer services and programs for populations in their program, as opposed to having purview over a broader target population. But maybe not. Maybe
yeah, and I think it is a very good question, and it's one. Clearly the question is, should Congress, authorize authority for SSA or for another federal agency to provide interventions for people before they've been determined eligible for SSD or SSI, and so I think certainly this research that we've discussed today certainly raises that question. But I think at the moment, SSA doesn't have the authority to do that. So, it's something that would require legislation.
Okay, I think our time is about wrapped up, and I'd like to thank everybody for coming. Jennifer, our next forum is on, is it on the slide here? Yeah. Okay, I just have to get down to there. Oops, too far. All right, it's on December 6th, and I think we're going to be presenting some findings from some ticket to work studies, actually. So anyway, thank you all for coming, and hope to see you next time.